critical thinking for Chapter 3.
Okay, our first critical thinking question. What are the different coding systems used for inpatient versus outpatient and/or physician office billing? Our answer to this is all 3 volumes of ICD-9-CM are used by inpatient facilities. However, physician offices and outpatient facilities use the first 2 volumes of ICD-9-CM, which is the Index and Tabular for Diagnoses, but use CPT and HCPCS codes for procedure coding. Now, CPT and HCPCS are more specific in their classifications for procedures, and therefore it's preferable for physicians to explain exactly what procedures were performed and the specific techniques associated with those procedures, rather than the ICD-9-CM procedure codes, which can be vague at times. Our next question. What is the difference between ICD-9-CM codes and MS-DRGs? Well, our answer is ICD-9-CM codes classify diseases and procedures and associate a number with each of those. Diagnoses are at least 3 digits, but can be up to 5 digits. Procedures are at least 3 digits and can be 4 digits in length. Now, MS-DRGs take those ICD-9-CM diagnoses codes and procedure codes and group them into the common categories. They are always 3 digits in length, no decimal points. The MS-DRG is dependent on many pieces of data, such as disposition of the patient on discharge, sex, age, principal diagnoses, complications, comorbidities, and procedures performed. They are first categorized by whether the patient's stay was medical or surgical, and then they are broken down further on the basis of body systems and procedures. The more complicated stays and surgeries will have higher MS-DRG weights, and therefore will have higher reimbursements. Okay, and our final question. What is the importance of knowing the coding guidelines and conventions as they relate to reimbursement? Well, consider a coder who has missed a coding procedure that could increase the reimbursement to the hospital. Or consider perhaps a missed manifestation code that was a complication or comorbidity that extended the patient's length of stay. With the absence of either diagnoses or procedures, there could be missed opportunities for reimbursement. It's sometimes necessary to review a record a second time to be certain that any significant diagnoses and procedures were not missed.